and that so many people that are dealing with chronic inflammation, chronic disease, we know we're so limited to the amount of patients that we can actually see. I'm fascinated by this health equity aspect of it. Can you explain it to us a little bit?
So we're looking at 5 main areas. The areas that we look at, of course, like you mentioned, healthcare access and quality,
Right.
education access and quality, looking at the neighborhood and the built environment, social and community context, and then economic stability. So I'll give you an example. And we have some incredible leadership in the city of Lauderhill, and they have used those 5 areas to sort of build in a framework to understand the needs of the community. And the community needs assessment was done that not only looked at health itself, but looked at the environment, looked at crime, looked at the entire environment and all of the factors that lead to health and wellness.
Welcome to the Hope and Help podcast, where we talk about science and science-based tools for fatigue and chronic illness. I'm Haylie Pomroy, #1 New York Times best-selling author and the former assistant director of the Integrative Medicine program at the Institute for Neuro-Immune Medicine. Why am I saying former? Is because I quit my job, guys, because I am now a PhD student. That's right, a lifelong learner, just like the rest of you. I'm working on getting my PhD in neuroimmunology. This podcast, our community, the Institute has just inspired me to first recognize that there's a lot I don't know, and second, that I am in one of the best places on this whole earth to learn from. We are privileged today because I am joined with the president of the American Heart Association in South Florida, Dr. Haffizulla. Dr. Haffizulla, can I call you Dr. H?
Yes, absolutely.
Okay,
you can.
thank you so much for coming today.
My pleasure, Haylie. It is so wonderful to be here. And congrats on getting your PhD.
Thank you. I'm working on it. It's going to be a journey. But I just, doing these podcasts, talking and getting all the questions from our community, I've always been a lifelong learner, but it really let me know that I was in the right place to learn the future of medicine.
Well, we need more brilliant women leaders.
Yes, we do. And that's, yes. And
Proud of
thank you for bringing women to the table, because that is one of the many reasons why I wanted to have you here. Your bio and your both medical, from a medical perspective, from what you do in the community, is so vast and so meaningful. You've made such an incredible impact on so many lives. You guys, I promise I'm going to put all of the bio on the blog posts that come with our podcast. But one of the things that really touches me is the strength that you have empowered so many women to accomplish things in their health. Where does that come from?
Gosh, I'm so happy you asked me that. I'm literally leading from my heart. And that heart, those seeds were planted from my mother. My mother, she was a nurse. She very much inspired me to be in healthcare and medicine since I was a very little girl. In fact, I would go to the hospital with her on my quote-unquote sick days. I'd pretend to be sick many times just to follow her. Yes. But I was supposed to sit at the nurse's station and color with paper and crayons. Never once did I do that. I always escaped onto the ward. And I remember just as a young child seeing little children and babies on a burn unit, tethered to cords and IVs, no families around them crying. And I remember feeling this intense, sharp pain in my heart to help and heal them. Wow. And that never went away. So that stayed with me my whole life.
That's exciting. That's so cool. We come from generations of healers. My mom was is an acupuncturist in the fertility space, and we were always in the fertility clinics. And even my kids, like my son and my daughter, got to see ultrasounds of triplets. And wonderful. I think instilling that the magic of medicine, there's still a lot of magic and mystery, and it can still be a beautiful, beautiful science. I think it's very cool. Yeah. And the seeds that our parents plant.
Yes, that's very much so.
That's amazing. How did you come to be at NSU? And we have a deep love for you at the Institute. And so I'd love for you to share with our listeners kind of how this whole family came together.
Well, I just feel so privileged, honored, and blessed to be here. And I'll tell you, it really mirrors kind of the diversity I experienced as a child in Trinidad, where I'm from originally, right? So here I was in the community practicing internal medicine. My husband and I are both here in practice. I have my own private, he has his. But, our children are here, all 4 kids are here as well. And then my oldest daughter had interest in NSU. She was applying. And then lo and behold, the MD program was starting up at the same time.
What is that, the ME program?
The MD program.
MD program.
Yes.
So you went to school at University of Miami,
I
right?
did. That's where I did my medical school training. And then I was at the Cleveland Clinic both the Cleveland Clinic Foundation in Ohio and here in Florida as well for residency training.
Wow.
But then we set up practice here. A lot of the physicians who end up training here stay here.
Yes, they do.
And so we did that. And, as we were in the community, I got involved in many different leadership activities. And then all of a sudden, the MD program, or the allopathic medicine program
Yes.
here at NSU, reached out to me and recruited me to be their assistant dean for community and global health.
Wow.
So I did that, and actually a lot of health equity initiatives were born there. And then our incredible dean here in the College of Osteopathic Medicine, she recruited me over to the osteopathic school to serve as a chair of medicine.
Very
so
cool.
I started there, and then my journey now takes me still on the health equity road.
Hey guys, it's Haylie Pomroy, your host. Right about now, you're probably struggling to achieve the health that you deserve, and you're just not sure what you need to do in order to get it. So what I've done is I've created a special link for you that will give you the nutrition and supplement programs that I use in my private practice to achieve amazing results for my clients and my community. Go to HayliePomroy.com/podcast. Plus, when you use that link, you'll get a 20% discount just because I love you. Again, that's HayliePomroy.com/podcast. Now, back to the episode.
And so Dean Wallace brought you into the osteopathic
Yes.
medical space. How did you start to work I know Dr. Klimas adores you. How did that relationship, how was that established?
I knew Dr. Klimas from University of Miami. It's amazing how small the world is. So this is many decades before I even joined, which is incredible. And she was just a mentor, a professor we just completely respected and were inspired by. And to now know that she was here, that was the seal that we needed to kind of move ahead. I said, oh, absolutely. We'll make sure we're here.
So are you still with the College of Osteopathic Medicine?
Yes, very much so.
And in what role?
So I'm an associate professor, and I lead many different health equity initiatives, and I'm on the legislative side of the college.
Yes.
So I'm getting involved on some of the advocacy end, on the politics, if you will, of medicine and the business side of medicine, just tying those roles together.
That's great.
So, I'm working very closely with Dr. Jim Howell. He's the former Secretary of Health for the state of Florida. Of course, our dean, who's incredible. We're just essentially ensuring that we keep our finger on the pulse of all the changes happening in medicine and healthcare to position our students very well, so that not only can they assimilate well into the climate of medicine as it's changing, but they're going to be natural innovators and master adaptive learners.
I love what you just said. So I had an interview the other day with an incredible MD that has a stronghold on curriculum at Harvard right now. Yeah. And we were talking about Dean Wallace and yourself and how we have to take our current medical students and indoctrinate them, if you will, with what is actually needed out there in medicine. I think there was a period of time, and there's a group of doctors that are almost going back to school now because medicine has changed so drastically in the last 20 years. But I think it's even more so since the pandemic.
Very much.
Yeah, and one of the things that Dr. Kamanoff was saying, Tony was saying that, none of us we deal at the Institute with a lot of chronic fatigue, myalgic encephalomyelitis, chronic neuroinflammation. And he said, most doctors won't see a lot of that in their practice. But with long COVID, all doctors are having to learn about neuroinflammation and inflammatory and chronic disease in general, how to treat the chronic patient, even if they're 22.
That's right.
Yeah, so I love, that's what both from a legislative, the one other thing that you said that for me was one of the things that brought me to NSU was our medical students, the fact that we travel and see underserved.
Yes.
Whether it's in India or the Galapagos or Peru, but also how much work we require of our students to do from an equity perspective in South Florida.
Very much
Can you
so.
share with me why why does that even matter? Why aren't we all just in Boston, the kind of the mecca of, universities, right?
Yeah.
And only treating people in large cities like that.
And I love that you asked me that question, because it's very important for us to know that there is not a one-size-fits-all for all patients.
Right.
We really have to understand our patients' backgrounds, where they work, live, play, eat, worship. Those are the social determinants of health. Those impact someone's health and wellness more than their own genetic makeup many times.
So sometimes we get somebody that says something that just gives me chills, because I know there are people out here listening. I know we just did a retreat where we got to meet people in person, And the fact that you just said that there's not one size fits all, and that you brought in the social components to health, I will share with you that most people out there aren't getting that kind of care. Mm-hmm. They're getting one size fits all solutions, and it does not matter what you eat or don't eat or how your stress level is or whether you sleep. I mean, we obviously here have a different mindset, but if I can, just because that was super impactful to me, I felt like you gave a lot of people permission to desire better care.
Absolutely.
Right.
Yes.
Thank you. What kind of verbiage can you help someone out there that's listening communicate to their doctor? Should they walk in the door with a portfolio, if you will, or a bio of themselves? Like, how can they get treated the way that we insist our medical students treat their patients?
I love that question. And I'll tell you, I tell my patients to stay empowered. Make sure you're informed and you're empowered in this process. And that understanding of who is treating you, that can happen well before you even get into a healthcare facility or to see that physician. We've got ways to see who does what where. Yes, of course, reviews are sometimes not always going to share the in-depth analysis of what might be happening, but you can interview a physician and a group. You can interview the healthcare system. We did that, I remember, my husband and I, when we had the first of 4 kids, we went into the pediatrician
and
saw if she was a good fit for us.
It's so funny that you said that, because OBGYN and pediatricians are the only time that people feel like they can interview a healthcare practitioner. And so my kids, we changed to UCLA, they were in LA at the time, and my son says, "I'm fine, why are you making me a doctor's appointment?" I said, "Because this might be your doctor." Mm-hmm. "Well, is he my doctor or not?" And I said, "I don't know, go interview him." And he said, "That's cool." And I said, "Absolutely."
Yes,
because when you are sick or you do have a problem, you have to make sure that you have an ally.
Very
and you
much.
use the word empowered, that you walk out of those visits. I always tell our community, if you leave the visit not feeling empowered, and especially if you leave the visit feeling deflated, defeated, or small, change doctors.
Yes.
Period.
And I'll tell you, we know that the administrative burden from the electronic health records and all the other pieces that pull doctors away from actually seeing their patients, that's contributed significantly to not only physician burnout, but that crunched amount of time that you see that strains the entire patient-physician relationship.
So how can a patient be more proactive in it? Because ultimately, they're the one that's going to benefit from a positive visit. So we have this form that's called a request for care.
Yeah.
We call it a Dear Dr. Sanders letter. It came from... I tell people this story reluctantly. There was a doc that I had to work with that was in Chicago. He was with this particular client. The client was having a really hard time. They couldn't get away from the particular practitioner. So as we started formulating letters before, we'd send it to the nurse, we'd send it to the office, and they'd walk in with a copy, 3 copies for the doctor. His name was Dr. Sanders. We adore each other now. I always say, worship the quicksand I walked upon when we first met. But my client couldn't communicate effectively, and he couldn't hear effectively. I'll say it was a very circular dynamic. And there was a big, massive problem. So as a community, we fill out this, we call it a request for care, Dear Dr. Sanders letter now. But I tell everybody, do not walk into the doctor's office thinking you remember what's going on with you. And also tell them something important about you, so that you stand out, that they remember you, but be really articulate, because there is the crunch time. Is there tools that you like if a patient walks into you and you go, oh, it actually takes stress off of you, what are some attributes that they can walk in the door with?
So use the electronic health record to your advantage. There is a patient portal. There are ways that you can electronically check in. There are ways you can communicate with the staff ahead of time. Share your records ahead of time if you can. I love that you said portfolio. Bring in a portfolio or a folder of all of your past records if you have it, all of your scans and labs, etc. That helps really allow a proper holistic assessment, rather than repeating some of the testing that might be done. That'll save on cost. And also, you have to realize as well, where all that information may not be digested in that one visit, at least it's something your physician and the healthcare team can look over.
Right. I always jokingly say, I wrote books, they're 200 and something pages, 200 ended up on the editing floor, but I sold a book on a 1-sheet.
Wow.
Well, you hope to.
That's right. I love that.
They go and pitch it. So you got to sell your case on a 1-sheet. You know what I mean? Bring everything, but have a summary. I love that. So can I talk about, I just want to bring us, and it's not just a selfish perspective, our communities ask this, women's health. What are some of the give me the top 3 things that are impacting women's health right now? Because it's changed in the last 20 years drastically.
Very much so. So heart disease remains the number 1 killer of not just women, but women and men in this country, it is really not budged. And that is horrific. And of course, with the pandemic, that just further amplified the situation.
So jokingly, we say, want something done well, give it to a woman, right? But on the serious side, we are outperforming men in heart disease right now, aren't we? In strokes and heart attacks.
And women are also underdiagnosed.
Underdiagnosed, yeah. And gaslit. I just have to throw that out there.
Yeah. Very much so.
Yeah.
And you'll find that the symptoms for heart disease, or at least if you're having any kind of poor blood flow to the heart, your symptoms may not be the same as a man. And it may be dismissed, as you mentioned, right? Could be just fatigue or just tiredness for a period of time, or pain that's not typical like you read in the textbooks, right? So I encourage everybody to go on the American Heart Association website and look at symptoms and look to see some of those resources.
And then if you're having those symptoms, make sure that you call those out to your doctor for your visit.
Absolutely.
Yeah, because a lot of times people, it's postmortem, it's after the fact.
Yeah.
They're in the hospital, they've had a heart attack, they've had a stroke, and they say, gosh, that's really weird. I was having nausea, I was having fatigue, I was having shortness of breath.
That's right.
And also, I know you guys have really good suggestions and I'd love to hear some of the suggestions from a preventative perspective.
And that is my passion, to prevent it. And my father and mother said growing up, an ounce of prevention is worth more than a pound of cure. That's a very well-known, saying.
I love that though.
And so ways to prevent. I like to focus on those 6 pillars of lifestyle medicine.
Okay.
And give a couple of tips and strategies along the way that you can adopt based on your own preferences.
Okay, I'm writing them down. Take me through the 6, and then we're going to go through them.
Absolutely. The first one, exercise.
Exercise.
Right? Just start to move. Now, you don't have to get a gym membership to move. You can park in the furthest parking spot and walk all the way in. You can choose to walk at evening or the morning in your own neighborhood. If your neighborhood, you're not so happy and it's not as walkable, go into a mall and just walk inside. You don't have to worry about the weather. Just find a way to move. If you have a sedentary desk job or anything else, elevate that desk and stand.
Yes.
Yeah,
blood flow.
Blood flow. You want to move your body any way you can.
Hey guys, it's Haylie, your host. I wanted to bring to your attention the possibility of coming in and doing a study with us. It is called the COVID UP study. And UP stands for Understanding the Post-Viral Phase. You have to be local in South Florida. There are 2 phases of this study. Let me give you the phone number. It's 305-275-5450. And the email is INIMresearch@nova.edu. We are currently looking for patients that are dealing with post-COVID, long COVID. We have 2 phases of that study. Please contact us and see if this could be an opportunity for you to get the care and information that you need.
Hola, soy la doctora Ana Palacio, de la Universidad de Miami. Me encantó participar en el podcast de hoy y quería invitarlos a considerar el estudio COVID UP. Este estudio está tratando de determinar por qué las personas no mejoran después de COVID. Si les interesa saber más de este estudio, por favor llamen al número 305-275-5450 o pueden escribir al email INIMresearch@nova.edu. Les agradezco mucho su interés y nos vemos la próxima vez.
Dr. Klimas, when I came in, and the whole team, but first thing she says is, she goes, I will believe every patient can get well. And everybody that walks through my door, I will hold out for them till the day I'm not here, and then even afterwards, she's convinced she's going to hold out that everybody can get well. Sometimes individuals that come in the beginning of our journey, they have POTS, they have myalgic encephalomyelitis, they've been diagnosed with chronic fatigue, and post-exertional malaise is part of their disease profile. So exercise can without, we measure VO2 max, we measure where the fatigue comes in. But one of our docs said something interesting, which is if exercise causes the disease state to be worse, you can do something passively like massage.
Yes.
Like even a really good one, we have acupuncture in clinic, like acupuncture, because it helps to regulate some of the stress hormones that exercise is so profound for.
Yeah, that's right.
Yeah, as well as it helps blood flow that exercise is so profound for. We can't get our nutrients to our fingers and toes without exercise. I mean, it's really difficult. So,
that's right. Even water, sitting in water.
Yeah.
You know, that also moves your
Changing
body.
the pressure.
Exactly, you are.
Yes.
So that is a nice way, especially
for the doctor
joints.
just prescribed a jacuzzi and a massage. That's what I'm taking home. Okay, check. Just massage, jacuzzi.
Yep. So that's the
walk
exercise
when you can.
pillar.
Yeah, or
Yes.
exercise to your fitness level.
Right. I mean, 150 minutes of moderate intensity exercise per week is what's recommended. You can go above and below that. You can make it more vigorous. However you choose to just move.
Yeah,
you
but I
know?
love what you said earlier with customizing.
Yeah.
There is not one size that fits all.
That's it.
So this is a category, and directionally, we are going to improve this of one of 6 categories.
Exactly.
I love that.
That's right.
Yeah, you're not going to be the next Arnold Schwarzenegger, or maybe you are, right?
Right.
But we also need to have blood flow and lymphatic drainage and
Very
nutrient
much so.
delivery. So we've got to figure out what's right for you.
That's right.
I love this.
And
okay.
this community, we love to dance as well. We put our music on and dance.
Nice.
That's very popular down here. So after exercise, of course, not even after it, these are all sort of on the same level because I love to approach them all at the same time,
Right.
is of course what we eat.
Yeah.
Right?
You're speaking my love
Oh,
language.
let me tell you, right? I mean, we grew up in Trinidad, literally growing our own vegetables
Right.
and our seasonings and spices from the backyard.
Right.
We wanted seafood. We were at the fisherman's wharf tasting the brine in that seafood or went to the farm.
Right.
Here, we've got to stay away from those ultra-processed foods that have a lot of preservatives and chemicals. More whole grains, whole foods, whole fruits and vegetables. Make a very colorful plate that's more plant-based.
Right. I always say food shouldn't be allowed to be called food if it's not food.
Yeah.
I mean, there should be no reason that the grocery store has an aisle that says healthy food.
That's exactly
I mean,
right.
it should not.
Yeah.
They should clock the doors if someone's trying.
You got it.
But they're willing to acknowledge it. We know it, right?
Yes.
That 90% of what's in your grocery store is not healthy.
That's right.
The closer you can get to patting the farmer on the back or growing it yourself,
Exactly.
that's when you're ingesting actual food.
Yes,
Yeah.
and get your family involved.
Yeah.
And you know what? Neighborhoods can have sustainable
Yes.
gardens as well.
Yes.
You know, there are different communities who are doing this so well in different ways. You can find ways to make it happen even if you don't have a big yard. There are different ways to grow some things within.
Right. And I think too, when you do farmers markets and stuff like that, it can become really affordable.
Yes.
And
Yes.
I love some of the vertical farming, although
Yes.
I get a little bit nervous about nutrient density, right? When we don't have organic soils involved. I'm a
Exactly.
soil scientist, so I studied dirt. So what did you study?
Very
Dirt.
important.
Dirt manure. Dirt manure, water, runoff.
That plays a huge role. That
yeah.
can poison your entire food.
Yes.
If it's not, you know.
Absolutely.
healthy.
And
Yeah.
you know what I just was reading the statistic about the insults on non-organic fruits and vegetables, right? Because there's the American Heart Association, many organizations have done such a phenomenal job driving home the importance of fruits and vegetables.
Absolutely.
But non-organic fruits and vegetables, because there's such a stronger market for them now, are some of the most adulterated. I mean, we were seeing turmeric being sprayed with paint the other day.
Unbelievable.
You know, I know.
Yeah.
You just, you know.
Yes. Yeah, I mean, come on.
Yeah, so if you can understand the source of your food, if you can grow your food, I love that. But every single thing we do is nutrient dependent. Sitting here right now is a nutrient dependent process. Sleep is the most nutrient dependent action you can have in your life, which regulates all of the nervous system and the heart and all of those things. You got to have nutrition.
Exactly.
I mean, you have to. So I'm so, Dr. H, thank you for driving that home for my community. I'm always saying it, but you have way
it's
more.
important. And our cooking show looks at this. We take foods enjoyed by different cultures and we make tiny digestible changes, like reducing the salt here, reducing
or
the sugar
changing the
content.
source. Yeah.
Changing the source, figuring out a way to keep that taste
Yes.
there and the identity of the dish present while not affecting the flavors.
And so you just mentioned your cooking show. That's where we're going next. I want to go through the 6 because
Yes,
I've got
let's
my
go
little
through
notes.
the 6.
But I everybody knows how my ADHD is such in service of you all today. You said something about changing something culturally. One of the things that I found too is if you go back historically to the culture of food, that when we had kind of the Industrial Revolution, when we started doing microwave foods, when we had, you watch food history, a lot of the cultural foods had natural ingredients now.
That's right.
And didn't have all the refined sugar and the food dyes and stuff. So a lot of times what I'll do is I'll take that cultural food, I'll do a historical deep dive on it and find out the origination or the origin, of those foods, and then we almost, I feel like we resurrect the true culture of the food.
Absolutely.
And it's such a fun experience because they understand that, we were doing this in the Hawaiian culture, like the refined sugars and the refined complex carb. That wasn't there. They had complex carbs.
That's right.
Yeah.
And the whole grain itself.
Yes, exactly. Okay, give me number 3. I mean, we could just stop with food and exercise, but I would love to hear all the other 3.
Well, you already mentioned sleep, which is very important, and that
Okay.
needs to be 7 to 9 hours of restorative sleep. So if you're waking up every hour, it's not going to count for you.
Right.
So how can you create a situation where you could start to wind down and really get that sleep,
Right.
as you mentioned? So important.
I just taught a class this last week. We had a retreat on adrenal fatigue and inflammatory diseases. And I was saying, if we could address diet, exercise, and sleep, I believe that 99% of the diseases that are existing in the United States right now would have no home.
Yeah.
Period.
Absolutely. Very, very powerful pillars if addressed. Absolutely. We would move that needle
Big
without
time.
a doubt.
Yeah, absolutely.
And the other pieces that tie in, of course, stress resilience.
Yes.
Finding ways to reduce that stress, being mindful, taking a moment to walk outside, connect with nature, play with your pet babies and your children and your family, and that ties to social connections, which is the next one.
But I love that you said stress resilience, not just stress reduction. Being an individual that's gone through different stressors, right?
Yes.
We all are. The most stressful thing that anybody can tell me is just reduce your stress. There are times when you can't get out of the stressful situation. Maybe it's a fractured femur, maybe it's a divorce, maybe it's the death of a parent.
Yes.
You can't, I don't have a magic wand to make that stress go away.
Exactly.
So the resilience or the adaptability in the human body is what keeps us out of trouble.
Yes.
And so I know you're going to talk about the social aspect next, but really gauging your stress and then seeing where, of course, get rid of what you can, but how do you infuse yourself so that you're more resilient? I love that.
Yes, I think over the years, I know I myself, I've learned ways to react and ways to protect your space. And if we can ensure that we stay within our own power, know that the ball is always in your court when it comes to that, you will find that you can deal with things in a way that won't make you sick.
Sometimes people say things to me on these podcasts that I feel like I'm not on a podcast and you're just here for me. Thank you. I needed to hear that today. Protect your space.
Yes.
Wow. I'm going to write that on my bathroom mirror. Protect your space.
Yes.
I'm an open person. I love people.
Yes.
I genuinely think everybody's scrumptious and squishy and I just adore them.
That.
I do. I really do.
Yes.
But sometimes there's things that are not serving me and and I need to be very protective of my space. That's mine. Thanks.
Your body knows when you're not in a safe space. And so listen to those cues and make adjustments.
But women are often taught, I'm just going to bring this up, to be pleasant about it, to be kind about saying no, to be, to protect your space. I'm sorry, but those words sound masculine to me. Like being protective sounds masculine. I love that I can embrace that personally because so many times we're taught to, smooth it over, keep the family happy. It's okay if it's not a positive interaction. Let's, see if we can somehow be the peacemaker of the family or things like that. So I love that.
So true. And stand firm. And you will, it's sort of an infectious way of living, which is a great way because then your children learn from you, everybody else. It sort of helps to diffuse all of the bumps in the road, if you will, and can have a preventive effect down the road, which is amazing.
So you guys, I brought a doctor on here today to tell you to protect your space, to be empowered during your medical visits, to exercise, to sleep, to have nutrition. And I mean, this is the top of the top. And so I'm excited for the next one.
Social connections. We're talking about sort of really playing with your friends and family members outside of your workspace, having fun, just enjoying life and building on that human-to-human connection. During the pandemic, we were all siloed, separated. And I know, especially in our Caribbean community, that wreaked havoc, really. Yes. And of course, there was a building up of many different, complications of disease states just from losing those social connections. And we saw it in our kids, right? Yeah. And how they had a hard time.
Weren't able to go to school, and we drugged my parents to the house. And we all ran to the ranch. We had to because I just couldn't. I mean, I was just so used to engaging, interacting, making food together. We didn't live, but we just said that's it. We can't be apart, so we have to be under the same roof. And,
that's right.
And that was I will say that was life-saving for our family. It was really, the kids came home and it was a really, I kind of miss it, quite frankly.
Absolutely. This is what life's about.
It is.
The people you love and the ones who support you, we're not islands.
Right.
We're here to connect, and that human side
Right.
of our existence should always be at the forefront.
And I think in a workspace too, it was when I was looking at different PhD programs, at first, this one in Neuro-Immune medicine wasn't ready or available yet. And I was grieving leaving my team here. Like I was genuinely, we have a lovely group of people who lead with their hearts, right? And I was grieving that social interaction from a work environment. I'd been a solopreneur for so many years.
Yes.
And I love that you say that. It's so important in your health. And also, I always tell everybody, remember, you can change. If it's not the way you like it, change it.
That's exactly
Yeah,
right.
that goes back to that empowerment.
We always have that power to do that.
Okay.
And then the final one was just really avoiding risky substances, like don't smoke.
Yeah.
Or avoid cigarette smoke if you can, and
Yeah.
alcohol. If you don't drink, don't start to drink.
And don't drink more.
Right, exactly.
No matter what they say about, we did a lot of mocktail cooking
That's
classes
great. Yes.
during the pandemic because
Yes.
people were starting to make
Yes.
all kinds of liquor at home.
Yes.
And I'm like, okay, I'm watching people, we were watching people because we had these big Zoom parties and, did a whole bunch of things.
We did the same. I love
yeah,
that.
but they were
I love
making
those.
cocktails
Right?
and like hard, a lot of liquor. And they were researching gluten-free liquor out of vodka, out of New Hampshire. They were sourcing tequilas, and I'm like, hold on a minute. This isn't going to get us where we need to be when this is all said and done. I know. So we started doing mocktail parties. We had a blast.
I love that.
Yeah, but yeah. So risk assessment. So we always do this thing called a health wish list, right? And whenever people like dream big, pretend like no one's going to read it. Like it's just you and your guardian angels or your parents in heaven or your God or whatever it is. Just to have this moment and dream about what your health would be like. And that's the health wish list. Then we do a health assessment, risk assessment. And we go we all know smoking's not good for us. I don't think anybody's smoking going, what? This is bad for me? We know we make decisions, we're all autonomous, but let's do a risk assessment and let's just look at what's in there that's not serving you. I will tell you, sometimes when we do the risk assessment, I always try to identify 10 things. People that are like, I am not going to quit my coffee and my smoking and my alcohol. I'm like, okay, let's look at the other 7. Because if I can get rid of some of these other things that maybe are benign, that you don't even think about, right?
Yeah.
You're using chemicals on your armpits.
Right.
You're drinking, diet, so, whatever it is that we think is a negative impact on your health. Let's do the ones that feel less traumatic to you. Let's get rid of those. And then you probably, as you get healthier, you're probably not going to want to smoke in that body.
Yeah,
that's the way I try to go after it.
Well, I love that. And that's a very collaborative sort of coach approach, which I think works extraordinarily well.
Yeah.
And, you're sort of doing a motivational process, motivational interviewing to figure out what people's intrinsic motivations are and then meet them where they are.
That's exactly what you said in the very beginning that I'm pulling it back to. Okay, I have to get, because I'm obsessed with food. Talk to me about your cooking show.
Oh, absolutely. So it started off focusing on the Caribbean and Latin American community.
I love it.
I literally I cook in my own kitchen, and there are dishes from across the Caribbean and Latin American region itself. We literally take those dishes and find small ways to reduce the salt, fat, healthier fats, maybe replace it with healthier fats, the sugar content, looking at portions and servings and so forth and so on. And we make mocktails. So I love that you mentioned mocktails.
It.
So we have non-alcoholic drinks on there. We talk all about all the possibilities. And then, of course, we enjoy the food together. We put the recipes out there. Everything is freely available to everyone. So seasons 1 and 2 started off just literally on social media. Season 3 was sort of broadcast ready, and we've got our YouTube channel, In the Kitchen with Dr. H. And now season 4, we are going global.
Oh, I love it.
Yeah, so all cultures are very much invited to the table. And I plan to go out of my kitchen and get into some of the restaurants and some of the places and spaces where people are cooking and enjoying food. And we'll talk a little bit about those 6 pillars as we're there, but I also want to capture the personal stories.
Yes.
Your why.
Yes.
Why this is important to you.
Yes.
And this dish, the significance of this dish, for example. And then finding ways that we honor the identity of that food and the cultural aspects of it while keeping it healthy and enjoying food, just having that joy of
yes,
eating.
Pleasure stimulates
Never.
the metabolism.
Yes, right.
Period.
Yeah, never
and when
wanna
you
help.
love what you eat, I think there's so
Yes.
much research, amazing research on having oxytocin and the love hormones and how it works on adiponectin and how it helps regulate your immune
right.
system.
That's right.
So even if it's you love it, like so, my last cookbook, in all the photographs, it is someone that I love's dishes and dish.
I love that.
So I have my grandmother's salt shakers. Yeah, I have my aunt, you know, like I have placemats from client, like I ask clients to send in things that were meaningful to them.
Yes.
And so even the dishes, like I'm big on, you know, I just traveled a bunch and I always bring some sort of dishes, plate, and glass home. but the vessel that the food is in,
Sure.
like what a benign, easy thing to improve your health.
Yes.
Right?
You eat with the eyes first, right?
Yes, you do, and your heart, and your
heart,
and your smells, and all of those things. So when you do these shows, like so right now, we've watched tons of them, and right now we're calling for sponsors for the new show. Correct?
Yes, we are.
Okay.
We are very much doing that. We want to continue this mission. So we are so deeply grateful to our sponsors. Now we are not able to do any of this work without that. But we're looking at seasons 5, 6, beyond. You know, we want to continue this moving forward in the right direction, honoring the stories from our community, amplifying the voices of our community.
And I love going into the
promoting health.
kitchens. Yeah. So we did a thing with Dr. Oz where I flew to this woman that had, I'm going to mess this up, 18 or 19 children. The family is beautiful. I know.
That's beautiful.
And I went in and we went into her kitchen and we had so much fun cooking for everybody. And we changed. She had a tremendous health trajectory change. I mean, her cholesterol came down.
Incredible.
Her HDLs went up. Her C-reactive protein came down. Her blood pressure stabilized. But it wasn't until I could go in and understand her.
Yes.
And her life and her kids and her family. Yeah, and we taught the kids how to make things, how to prep, how to chop veggies. It was really, really meaningful.
You were personalizing that entire experience for her.
Food is medicine.
That's how we are able to make sustainable change.
Right. So, okay, so how would somebody get a hold of you? So I know everybody's going to watch this. They're going to, okay, I will not let our community get a hold of you to ask for a doctor's appointment or for medical advice. That's for me. No, I'm just kidding.
Anytime.
So when you host the show. But how can people get a hold of you if they want to sponsor the show? So we have a lot of like really cool natural health viewers in our space that love to foster healthy food and healthy eating and a show like yours that's making life changes right in the trenches.
Absolutely. Well, I'm going to do this. I'm going to give out an email address here from the university, right?
Okay.
So you can email me for sure at FHAFFIZULL@nova.edu.
Okay.
Or you can go on our website, NSU Caribbean Health, and I'll spell Caribbean Health.
Please.
CARIBBEAN Health, HEALTH.com. And you can go ahead and fill out the contact form over there.
So I will definitely put this in all of our digital stuff. But this is not where someone calls to make an appointment with you.
No,
this is to
not
be.
at all. This
So if anybody wants to
cooking show.
participate in the cooking show
Or health equity initiatives. Yeah.
Okay, and we're going to talk. That's the next thing we're going to jump on really quick.
Yeah.
But you guys send an email, but do not send an email looking for a doctor's appointment, please. That is only for me. No, I'm just kidding. So there's so many. Please, one. Tell me you're going to come back because I feel like
it'd be an honor.
Okay, good.
This was a highlight of my.
There's so many topics that I haven't gotten to yet.
I love it.
But I want to talk about the health equity initiative. So
Yes.
when Dr. Klimas, when I sat down with Dr. Klimas, and we decided what we wanted to do with this podcast, her biggest thing was that she said that just keeps her awake is lack of access. Right?
Yes, that's right.
And that so many people that are dealing with chronic inflammation, chronic disease, whether it's Parkinson's, Alzheimer's, autism, ME, CFS, all of it is that we know we're so limited to the amount of patients that we can actually see.
Yes.
And we also know that we do have patients that travel from all over globally and in the United States, but that's at a cost.
Yes.
Not just time, but financially. So we know when people walk in the door, we have a very reduced, we have a sliding scale in the clinic. I didn't know if you know that. We're very proud of that.
It's wonderful.
Yeah, it's very cool. But it's still, for every patient that we spend 3 hours each visit with, we know that there are hundreds of thousands, millions that aren't getting access. So I'm fascinated by this health equity aspect of it. Can you explain it to us a little bit?
Absolutely. So we're looking at 5 main areas, right? So the cooking show is actually born out of a lot of those health equity initiatives, right? The areas that we look at, of course, like you mentioned, healthcare access and quality,
Right.
education access and quality, looking at the neighborhood and the built environment, social and community context, and then economic stability. So approaching it from all of those aspects and all of those pillars allows us to get a sort of a comprehensive view of the needs of the community. So I'll give you an example. And we have some incredible leadership in the city of Lauderhill. I'll just shout out to them. The Commissioner Melissa Dunn, and City Manager Desiree Giles Smith, they together co-founded the Lauderhill Health and Prosperity Partnership and asked me to come on as a co-chair.
Very cool.
And so I co-chair along with 2 other folks. And they have used those 5 areas to sort of build in a framework to understand the needs of the community. And the community needs assessment was done that not only looked at health itself, but looked at the environment, looked at crime, looked at the entire environment and all of the factors that lead to health and wellness. And then hearing now and looking at the data and hearing from the community in some of these initiatives allowed them to make certain initiatives move forward and to build out the areas that needed to have growth in order to solve some of the problems in the community.
So it's interesting that you say that. We have such a unique, Florida has a very unique medical exposure for practitioners. From me coming from Southern California, Colorado, I'll just say it's very different here. We have a lot of tropical diseases that we don't see in other parts of the United States. We have a lot of different environmental toxins that are all over the United States, but are widely recognized, like mold toxicity, things like that.
Yes.
We had a patient that came in from Colorado, and their doctor literally told them, there's no way you have a mold toxicity, environmental illness based, because you live in Colorado and it's a dry climate. They had water damage in their house. We figured that one out. Right. But the docs here are so exposed to it. I was working with one of the docs in our infectious disease, strictly in parasitology. And part of it was because my daughter ended up in the hospital in UCLA, one of my favorite hospitals. I love UCLA, but we were having an infectious disease issue that I said, I need somebody that actually sees human to animal communicable diseases, right?
Yes.
So I had to find a doctor in Florida. It's long before I was down here, because you guys have such diverse exposure. I mean, and also it is like LA is a melting pot, but there's a different flavor, if you will, to South Florida.
Exactly.
Right?
Every area is going to be a little bit different.
Right.
But there's a way to sort of get an environmental risk assessment. We can use technology to do that. With the advent of artificial intelligence entering healthcare, if we can harness that power of technology to connect our communities more and ensure that we break down those barriers, we can have not only better access to quality healthcare and quality assessment, but also we can ensure that we're personalizing the experience for who we're treating.
So our perspective, and I love working with Dean Wallace on this, is infusing our medical students, right?
Very much so.
Infusing our medical students to provide better care.
Yes.
How does the patient that's out there, that's walking into their visit, communicate, and I'm just giving you this question on the fly, sorry, but my brain wanted it. How do we communicate? I'm walking into the office, how do I get equitable care? Do I communicate with them my socioeconomic situation? There's a demographic piece when you fill it out.
Yes.
But what would you say the top 3 important things that you've learned by being involved in this massive amount of data assessment, right? Or looking at all the different variables? What are the top 3 things that someone should bring to their doctor visit from a knowledge perspective that they should share with their physician? Like I always tell my kids, we've been international. You work with livestock. I mean, those are like, you literally are in the thick of working with livestock. That's not normal in Southern California.
So
it's something that I always tell my kids, you end up in the hospital, and it happened to both of them. You end up at UCLA. First thing you say is, I work with livestock. You let them know. That's something that maybe people wouldn't think about telling their doc. What would be
They may not ask you that in the history.
Right, especially if you're in Manhattan.
Yes. So, again, to really keep it very personalized, because there might be other variables that we may not consider important that might be important to a diagnosis. Like you mentioned in the very beginning, create like a one-pager. that summary of maybe what has happened over the last 6 months in your life, right?
Are we still valuing family health history a lot?
Absolutely,
Okay.
very much so. So your past medical history, your family history, your social history, surgical history, any medications that you're taking, any allergies that you have. I would even talk about your preventive health as well. Have you had your screenings, like for the mammograms or colonoscopies, et cetera, et cetera? Any blood work that you may or may not have had, and then, of course, talk about symptoms that you're experiencing, things that you want brought to the table. You can, again, use that patient portal to your advantage and complete a lot of information ahead of time. And there is a form that we typically use to collect those social determinants of health. If your patient portal from the electronic health record used by the health facility that you go to, they don't have that, you can print one out online and complete it. That's a prepare form.
So I'm going to say something that I've said it. So every Friday we have clinicals, which is like, even though I'm not technically working, I was in Spain and I literally logged into our clinicals. I cannot, all the docs get together and we all contemplate stuff.
Yes.
And it's just brilliance in a room. I love it.
It is.
But I'm always, I don't know, I'm always bringing up a different perspective sometimes that everybody totally disagrees with. And I have said this, and I think I've got them to come to my side a little bit. There are a lot of doctors that don't look at all of that data before the visit.
That's right.
That it's used a lot for larger health initiatives to collect data to know if this person is prone to slipping and falling, and also for insurance companies to know where to funnel their money. So because you fill it out, I just want people to know that some docs read it and some docs don't.
That's right.
So don't feel like I've already told your office this. Have that direct communication with the human being that you're seeking care with.
Exactly.
In a really human way.
Absolutely.
Okay.
And you can point out the things, like you mentioned, the things that you feel, this is significant and a change for me. I love that. I love that you mentioned that. Yeah. And use a whole staff as well, too. The nurses, the MAs, the part of the team.
I'm a kiss butt for my doctor's visit. Like, here's books, here's bars, here's treats, here's homemade jerky. No, I do, because
they will never forget you.
I know. I hope not. But I get called back, and I don't know. I mean, they're non-biased, but we are human.
That's right. We are human. Respect each other, love each other, show that care.
Yeah, and
empathy.
walk out. I wrote one size doesn't fit all. I want everybody to walk out empowered. The more times I get brilliant people like you to tell people like myself and my community out there that we deserve good care, the more it's going to sink in.
Yes.
Because a lot of people, I had somebody the other day, so I got to ask my doctor if I can go off of that. And I said, but your blood pressure is super, super low. Call right now and ask. And then I went, that's an interesting thing to ask permission for.
But
it's the way we've been raised and trained, but things are changing. I mean, we got, we had the pandemic sped a lot of stuff up. So it was funny when I first brought that thing up about, you fill out all your things, but do the docs really read them? Our docs were like, yes, we all read them. And then I brought one day the amount of forms, because we're a research facility.
Exactly.
And I said, there is no way you know all this. They said, well, we learned it in our 3-hour meeting. And I said, okay, but I want you to have a one sheet. So I had to drive the point home. YouTube, you have an incredible YouTube channel right now. It's In the Kitchen with Dr. H.
You got it.
Okay, great. I want to come and play with you. I want to come cook with you.
I would
come
love
just watch
that.
you
That
cook.
would be a dream for us. We would love it.
And I want to make sure that you do come back. This is great. This gives our community so much empowerment.
Thank you, Haylie.
And the women and the men that listen to this, just a lot of permission to advocate for themselves.
Absolutely.
Yeah,
we're in this together.
We're in this together.
And we're leading with our hearts, with compassion and empathy. We're going to accomplish a lot together.
I agree.
Keep our community healthy.
We're lucky to have doctors like you. We're so lucky to have doctors like you. And thank you for spending time with me. I know you are a very busy woman, and I look forward to having you back. And you guys post lots of questions for Dr. H. You heard it here. She promised to come back. Do not email her for a visit or for medical advice, but please email her if you'd like to participate in the show and support the show. It is amazing. I can't wait for you guys to all watch it. Make sure you give it 5-star reviews. And if you want to participate either from a sponsorship perspective or you think you have a great recipe that you want to see converted into an even greater recipe because it makes a positive impact for your health, please make sure you let Dr. H know. Thank you so much. Thank you again from the
Haylie.
Institute, but from myself, selfishly, thank you for being here. I appreciate it.
It's an honor, privilege, and a pleasure. Thank you, Haylie.
Absolutely.